Hi everybody, I'm Dr. Joseph Cipriano, and today we have our professional paintballer over here. Ashley was telling me the injuries that you've been having, you're not obviously as you were, 10 years ago when you were, in your 20s. 30-year-old body's kind of taking a little bit of a toll on you. And then you told me about after your last practice, getting quite a bit of pain on that low back.
Yeah, lower back, starting to run down my leg a little bit. Previously had some sciatica and some numbness, but it's just not as bad this go around. So.
Okay. So now, he was originally seeing me at the other office in Greenville and is now, I know originally when you first came to see me in Greenville, that was a lot worse, that low back and the right leg.
Absolutely.
It was more numbness and tingling. And then since then, it's gone down quite a bit. But then now you had to do something to just ruin all my work.
For sure.
All right, so what we're going to do, the main thing so I know is really in that low back right there. So we're going to start off, I'm going to have you lay face down for me. Let's see, so we're going to scan the entire body. We're going to see if there's any changes, anything going on. Now I always look at the symmetry, what I notice on the right. We want to compare the right to the left. So we're really going to be looking for that symmetry here. So now in the neck, all through here. Okay, not too bad actually, not that tight. Staying pretty good up through here into the traps. So we're going to go from that cervical spine now into the thoracic spine. Okay. Not too bad, not really tight, which is a good thing. Muscles are not taut. Definitely very well. Getting a little bit of, when I push in, I feel almost like a little bit of a divot. What that's telling me, we just have a little bit of a fixation, so we're going to want to do some adjustments in that thoracic spine here. And coming through, so we're going to go through that thoracic and then now into the lumbar spine. So now for him, and in his case, he's got a little bit straighter of a low back, so we're just going to focus on, we want to get that curve, that lumbar lordosis, a little bit more into that low back, and then we really want to realign those hips because he's having pain from that right side kind of going down into that right leg. Let's go ahead, I'm going to push over this area. Any pain with that?
Yes, a little bit of soreness right there.
A little bit of soreness? Okay. What about the left side?
Left side's good.
Left side's good. And directly over the center?
Center's fine.
Center's fine. Okay. So we're going to come down here. We're going to check that leg length out. So it's pulling a little bit short on that right side here. So it's not a huge difference, but then also when we scan up the body here, we're noticing this left side is raised up right in through here. So we want to just balance out those hips and get a lot of pressure removed off that right side for you today. Let's go ahead, we're going to start with the massage device. We want to relax the areas, especially in the low back for you. Let's get this going. Yeah, so I use the Hypervolt by Hyperice. Honestly, it's very small, it's portable. It's actually pretty darn powerful too. So this really helps loosen up a lot of the muscles in here. Get rid of any bit of that tension that you may be having. How's that feeling for you?
Yeah, I can definitely tell that thing of line helps out tremendously.
Good. There we go. Perfect. So now that we've got that a little bit relaxed here, we're going to go ahead, we're going to start the adjustment as we normally do. So I like to start everything up here at that cervical thoracic junction. Okay. So we're going to do that T1 on the left here. Good. Gonna drop down that T2 on the right. There it was. Good. Okay. So let's clear out that thoracic spine that I was feeling a little bit earlier as I was palpating down. So we're doing a prone thoracic adjustment right now. Okay. I'm gonna have you take a deep breath in and exhale all the way out. Good. One more time, deep breath in, exhale all the way out. Good. Just go one more time, a little bit lower here. Deep breath in, exhale out. Good. Okay. So now we're going to focus on this low back, that chief complaint area. So I'm going to stabilize on that sacrum. I want you to raise this right leg up as high as you can for me. Any pain, tenderness, tightness with that?
Just a little sore.
A little sore? Okay, relax. Raise the left side for me. Okay. As you can probably tell and feel it.
Absolutely.
Yeah, that left side raises up, just literally no complaining at all. What we're going to do, I want you to cross that right foot over the left foot for me. Good. And we're going to do some drops on that pelvis here. So what's happening is his sacrum is rotating off to the left, which, as you can tell, his left leg was able to raise up a lot more compared to that right leg. So we're going to do a counterclockwise torque, and we're going to bring that sacrum back to midline. Good. Uncross. I'm going to have you bend this knee. Good. Let's give it a little more tension. There we go. Perfect. So now when I come back and I check out that leg length here, already. So that right leg that was short is now balanced. Now also what we're going to check, I'm going to stabilize on that sacrum. I want you to raise that right leg up again for me. Do you notice a difference?
Yeah, definitely a little bit better.
Yep. And raise that left one up again too. Good. Alright, what I'm going to have you do, I'm going to have you lay on your side and face me. Good. We're going to bend that top knee. Just like that. Good. Good. Flip to the other side.
And this would be the sore side.
Yep. And we'll get a little bit of movement as well then through here. There we go. Lay flat on your back for me. Nope, back. There we go. Alright, so now just because you've been having like that sciatic type pain going down, I want to do leg pulls on each leg just so we can take any pressure off the ankles and knees and going into the hip. And especially with, I don't know if any of you guys know, like with the professional paintballing like he does, literally like when you're looking at one of those fields with all like the blow up devices and you're running through and you're shooting, that's what he's doing at a little bit more of a level than, you know, just having fun with your buddies. You're out there, I mean, it's pretty strenuous on your body, I can imagine.
Oh yeah.
Relax this leg. Good. Good. I'm gonna have you come on up. Okay. Let's do, I want to finish out with the thoracic spine here. So I'm gonna have you stand a little bit in front of me. Good. Arms out by your side like that. We're going to do that standing intercostal adjustment here. Put your arms up and over mine for me. Just like that. I'm going to lean you back onto me. Squeeze your elbows together. Good. Perfect. And take a seat right here for me. Face that way. Okay. So I'm going to have you Give yourself a big hug. Take a deep breath in. And exhale all the way out. There it was. Lay back from it.
Oh yeah, that was a good one right there.
Yeah, that just opened everything up and down. Alright, so we're going to do the Y strap. Now he has experienced Y strap multiple times, so he knows exactly what this is going to be like. Good, and relax. So we use that Y strap. We do a Y axis decompression here, so we really want to decompress that entire spine. There we go.
Oh yeah.
How'd that feel?
That was stellar.
Perfect, come on up. There we go. How are you feeling?
Great.
How's that low back?
A lot better.
A lot better?
I can tell immediately that that's going to be the ticket.
Good, good. Perfect. So if anyone is looking to schedule an appointment, I'm over here in Spartanburg, South Carolina. I leave everything in the description, drjosephcipriano.com. Feel free and send me an email through there, or you can call or text the number. Yeah, I'd love to get you in. Have a good one, everybody.